Bismillahirrahmanirrahim. After studying the basics of the cardiovascular system, we are now proceeding to the diseases of the cardiovascular system. And the first one of them is atherosclerosis. Atherosclerosis is a progressive, degenerative arterial disease that leads to occlusion. Occlusion का मतलब है कि उसका सुराख बंद हो जाता है. That leads to occlusion of affected vessels, reducing blood flow through them. It is characterized by plaques forming beneath the vessel lining within arterial walls. An atherosclerotic plaque, इसे प्लेक कहें, प्लाक कहें, this is it. This is the atherosclerotic plaque. It consists of a lipid, ये बीच में lipid है. It consists of a lipid-rich core covered by an abnormal overgrowth of smooth muscle cells, topped by collagen. Collagen नजर आ रहे हैं. Collagen-rich smooth muscle cap of the plaque, covered by an abnormal overgrowth of the smooth muscle cells, topped by a collagen-rich connective tissue cap. As plaque forms, it bulges into the vessel lumen. ये सुराख था इसका वेसल का. और ये जो एंडोथेलियल लाइनिंग नजर आ रही है, it was here. But then, due to some disease process, the fat collected underneath the endothelium and made a plaque. Now we are going to study how the atherosclerosis occurs. The process of atherosclerosis starts with injury to the blood vessel wall. ये देख रहे हैं, normal blood vessel wall है यहाँ पर, और यहाँ पर injury हो गई है. This triggers the inflammation. Inflammatory process को आप पहले से अच्छी तरह जानते हैं. Now the blood has got cholesterol. When the free radicals are present, they cause oxidization of this cholesterol. So oxidized cholesterol, free radicals themselves, जैसे कि H2O2O, high blood pressure in the vessel, जिसमें से blood गुजर रहा है. Homocysteine, this is an amino acid present in the blood. Chemicals released from fat cells, or even bacteria and viruses damage the blood vessel wall. ठीक है? So the process is occurring underneath the endothelium, and the chronic endothelial injury is caused by hyperlipidemia, having oxidized cholesterol, hypertension, that is high blood pressure, smoking, that produces free radicals, homocysteine, hemodynamic factors, जिसमें sharp bend in the vessel or something like that. जिस तरह पेशेंट्स जो है वो लेटे रहते हैं और उनके लेटे रहने की वजह से स्टेसिस हो जाती है, तो हीमोडायनामिक्स चेंज हो जाती है. टॉक्सिन्स, वायरसेस and antigen antibody reactions all damage the blood vessels. Now, what happens when excessive amount of LDL cholesterol is oxidized by the free radicals? This produces changes in the endothelial cells that produce chemotaxins for monocytes. These are the monocytes, and when there is injury to the endothelium by the factors given in the previous list, this injury allows the LDL to enter the space underneath here. This LDL is oxidized by free radicals, and then these This LDL causes endothelial cells to produce chemotaxins that attract the monocytes, and this is a process of chemotaxis occurring here, and the monocytes are going to go in underneath the endothelium. When they go underneath the endothelium, this triggers a local inflammatory response. So the endothelial dysfunction, increased permeability, leukocyte adhesion, क्या हुआ? Inflammation है ना, and then it causes monocytes to adhere and migrate into the space underneath the endothelium. Now you see this picture here. Under the endothelium, the monocytes that had migrated have become macrophages, and they are now causing phagocytosis of these fat droplets. क्या होता है इन fat droplets में? This is oxidized LDL. Now this oxidized LDL, when it is phagocytosed by the macrophages, these macrophages become packed with fat droplets, and these are called foam cells. Apart from that, you see muscles, smooth muscle fibers now being activated from the lining of the vessel wall and going into this space. These are platelets here and platelets here, and they also collect because of injury to the endothelium. और ये आप फिर उसमें पढ़ चुके हैं जो हमारा थ्रोम्बोसिस का चैप्टर था. You have seen these foam cells underneath the endothelium. When they get filled with fat droplets, there appears fatty streaks. This is yellow color now is evident under from the outer surface of the endothelium. अंदर की surface तो ये है ना, और यहाँ पर outer surface में भी आपको yellow color नजर आ रहा है, and this is showing you fatty streak. Fatty streaks, the yellow colors are visible from the lumen of the blood vessel, and here you see macrophages and smooth muscle cells. Both of them are engulfing the lipid droplets, and the lymphocytes have come in there to produce further inflammation. Just have a look at this picture first. This is the plaque. This is the collagen-rich smooth muscle cap of the plaque. This is the normal blood vessel, and this is the lipid core of the plaque, and this is endothelium. The smooth muscle cells within the blood vessel wall migrate by chemotaxis from the muscle layer of the blood vessel on the top of the lipid accumulation just beneath the endothelium. आए तो यहाँ से थे ना, इधर से आए, इधर आए, और फिर उसके बाद उन्होंने उसकी टॉप पर भी एंडोथेलियम के नीचे भी पूरी लेयर बना दी है. The smooth muscle cells divide and enlarge, producing atheromas. अब जब ये smooth muscle cells जो हैं ये activate हुए, then they divide and they enlarge in size, and this is the normal blood vessel wall, and this is the inflamed blood vessel wall, and where you see this portion is called atheroma. Together the lipid rich core and overlying smooth muscle form a maturing plaque. Previously it was maturing plaque. Previously it was just the process that had started, and now we say that the plaque has been formed. This plaque will now mature further as we see the stages of the atherosclerosis further ahead. You see that this plaque that was maturing plaque in the previous slide is now matured into a big plaque that has almost protruded into the lumen of the blood vessel. Now look at the composition of this plaque. It has got this endothelial lining. Underneath that is the smooth muscle fiber proliferation. Underneath that you see certain fibroblasts producing collagen fibers, and then you see extracellular lipid droplets here, and then you see a macrophage which is the foam cell now. पता है ना कि मैक्रोफेज बड़ा होकर फोम सेल बन जाता है जब वो लिपिड ड्रॉपलेट्स को एनगल्फ कर लेता है. One foam cell you see here, the other you see here, and this is the lymphocyte that is causing inflammatory process to further enhance. These are the smooth muscle fibers that have been activated and that have caused lipid droplets to be engulfed by them, and this is the composition of the plaque. Now coming to the function of this plaque, when the oxidized LDL is present here, it inhibits the production of nitric oxide by the endothelial cells. याद है नाइट्रिक ऑक्साइड कहाँ बनी थी? It was formed in the endothelial cells जब आप पढ़ रहे थे microcirculation. So it was formed here and then it seeped down to the deep muscle layer and caused relaxation of that deep muscle layer. So when the nitric oxide is not being formed by the endothelial cell because of presence of oxidized LDL, this produces lack of relaxation of the smooth muscle fibers on demand. Now, the calcium ions, when they see such an area, they try to seep in and deposit themselves here. Calcium is in abundance in the vicinity here, and it just seeps in here, and this produces hardening of the blood vessel wall. Hardening of the blood vessel wall causes lack of distension. अब आप याद करें वीनस रिटर्न वाला पिछला लेक्चर जिसमें हमने देखा था कि vascular distensibility was responsible for venous compliance, so that the pressure in the veins would not increase and will accommodate the volume of blood into it. When the venous compliance is not there in the arteries, this produces increase in the pressure gradient within the arteries. When the vascular compliance, vascular distensibility is not present, this produces increase in the blood pressure within the arteries, and that is something that is a consequence. That is, the atherosclerosis is a process that causes plaque formation in the blood vessel, and this hardening of the blood vessel along with lack of dilation of the blood vessel along with narrowing of the lumen now produces the diseased process that is called hypertension. Not only the thickening plaque produces narrowing of the lumen, it also interferes with the nutrition exchange for the cells that are located within the involved arterial wall. When the cells in the arterial wall do not get nutrition, they degenerate. And this degeneration of the wall occurs adjacent to the plaque, so that the further endothelium is also damaged and the plaque extends to that area as well. Number 11, the damaged area is invaded by fibroblast. Fibroblast क्या होते हैं? जो कि फाइबर्स बनाते हैं, किसी भी चीज को वॉल ऑफ करते हैं इन्फ्लेमेशन में. यू हैव स्टडीड इन्फ्लेमेशन एंड यू नो दैट वॉलिंग ऑफ इफेक्ट of the inflammation was by virtue of function of fibroblast. So the fibroblast or the scar forming cells invade this area and form a connective tissue cap. अब ये पक्का हो गया, plaque के ऊपर connective tissue cap बन गया. Now it is constant feature of the blood vessel, and this is called sclerosis. Sclerosis means excessive growth of the fibrous connective tissue. So now you see the term atherosclerosis, which is the process that we are studying, is characterized by presence of atheromas and Sclerosis by the fibroblast. Atheromas were the activated muscles engulfing the fat droplets and making a bulge in the vessel wall, and sclerosis is the fibrosis along the vessel wall along this bulge of or atheroma, and the total process will become atherosclerosis. This is the process that we are going to see is going to cause trouble in the body, and the preventive features for this atherosclerosis we shall be discussing just now. Now coming to the factors that prevent atherosclerosis, a healthy lifestyle is essential. Which is healthy lifestyle? A lot of exercise, low fat diet which contains polyunsaturated fatty acids, addition of fruits and vegetables to the diet help prevent atherosclerosis, along with other factors that are: number one, antioxidant vitamins that prevent LDL oxidation, such as vitamin E, vitamin C and beta carotene. अब ये आपकी हेल्दी लाइफस्टाइल में शामिल है कि आप ये विटामिन्स खाएं in form of fruits and vegetables. Atherosclerosis, number two, atherosclerosis is inversely related to concentration of HDL or the good cholesterol. HDL का मतलब है हाई डेंसिटी लाइपोप्रोटीन. इसके अंदर लाइपोप्रोटीन ज्यादा होती हैं और बीच में कोलेस्ट्रॉल थोड़ा होता है. इट रिमूव्स, इसके अंदर कैपेसिटी होती है कि और कोलेस्ट्रॉल को एब्जॉर्ब कर लेगा क्योंकि इसमें कोलेस्ट्रॉल थोड़ा है. इट रिमूव्स कोलेस्ट्रॉल फ्रॉम द सेल्स एंड ट्रांसपोर्ट्स इट टू द लिवर for partial elimination from the body, and it also protects by inhibiting the oxidation of the LDL. अब जो partial elimination from the body है उसमें ये है कि बाइल के अंदर आपको पता है कोलेस्ट्रॉल is removed. So if HDL is more, it will take the cholesterol from the cells and will bring it to the liver where bile will be formed, and in this form cholesterol will be removed. So we have studied that the vitamin E, vitamin C and beta carotene are responsible for preventing oxidation of the LDL molecule. Now coming to the B vitamins, three vitamins, folic acid, vitamin B12 and vitamin B6 out of the B vitamin family plays key role in pathways that clear blood homocysteine. What is homocysteine? It is a byproduct of metabolism of an amino acid called methionine. So when methionine is metabolized, homocysteine is produced, and these three vitamins clear it from the blood. And then number fourth is that aspirin inhibits clot formation by its antithrombotic effect and anti-inflammatory effect, and that you are going to study in the biochemistry, and we shall also be discussing it when we are going to discuss coronary artery disease in the future. Tomorrow we shall be studying hypertension, and I hope that will be completed within one lecture, hopefully so. Okay, that's all.